We are outside Mumbai's Sion hospital where many patients are being treated for COVID, even though it's not exclusively a COVID hospital. But videos out of this hospital shocked the nation after we all saw bodies that were wrapped in plastic in the same ward as patients were being treated. While this created a furor and the dean of the hospital was demoted, what do the doctors on the ground feel? A number of resident doctors that we've been talking to say that the media has not fully understood how overstretched and under pressure the system is. And we're going to talk to some of these doctors here. These are all 4 doctors who work at Sion Hospital. Akshay, Avinash, Rishabh and Vishwadeep, all 4 doctors work as resident doctors at Sion Hospital, and it's important to remember that the frontline warriors of this battle really are resident doctors. So I'll ask the camera now to move in and we'll start talking to these doctors one by one. Is there another side to the story of the videos that we all saw? Let me start with you. Those images shocked India. How do and the explanation was that the families are not claiming the bodies. But a lot of you have been feeling demoralized. Why?
Actually, ma'am, like we said, they saw the video from outside. We have been through that environment, and it's very bad for us also that we see all these things. But there are certain technical difficulties.
For example?
There are certain formalities which are to be completed before we hand over the body, and in this pandemic situation there are a lot of other things like the ambulance need to hand over that body straight away to the cemetery. We should not infect the environment, so directly it should go over there.
Why did you feel demoralized when that video leaked?
Ma'am, actually we all are working, not just we, apart from the actual doctors and all, healthcare workers also, nurses and everyone. They are working so hard in this pandemic situation and they are fighting against COVID-19. So if people start blaming us, so it will ultimately demoralize all of us.
What's your age?
I'm 24.
24 years old. That's really how young the main frontline doctors are. Let me just come in here, Akshay, if I can.
Yeah.
Thank you. Let me ask you, to me, if I see that image, what it suggests is a hospital system that's overstretched. Now, first to clarify, Sion is not exclusively a COVID facility.
Yeah, Sion is not a dedicated COVID hospital, but it's still carrying the COVID and non-COVID patients both. That's why you can see when you are catering to a COVID and non-COVID patient, that definitely the workload is going to increase. And at such when workload and patient number increases, definitely the administration, definitely the hospital infrastructure will be at stretch to treat each and every patient who is coming to Sion Hospital.
Are you overwhelmed? Is the hospital overwhelmed?
Yes, definitely, because as I said, and you are also aware of it, that Sion Hospital is not a dedicated COVID hospital. Then every patient comes, then we need to test each and every patient who is coming to Sion Hospital. When test result come, then we get to know that this is a COVID patient, this is non-COVID patient. Then when patient is in normal ward, then we have to shift the patient to non-COVID ward, and whole of the scenario changes. So in that case also, when patient is COVID but report is yet to come, for that time we have to keep the patient in the COVID suspect ward, and everyone has risk till the report comes.
So now tell me, because I drove here from Delhi and traveling through many states, and in Delhi we have many of the public health hospitals becoming purely COVID facilities. Do you think that should happen here?
Actually, ma'am, if all hospitals become COVID hospital, then who will treat the patients who are non-COVID? There are some emergency cases, like suppose one pregnant woman in her 9th month of pregnancy, where will she go? Then somewhere we have to keep the COVID and non-COVID hospitals separately.
So this is a dilemma. But you are saying that it's an overwhelmed system. I was reading online that a number of the young resident doctors are also feeling, in a sense, orphaned by the system. Yeah, they're feeling like, हम लोग तो यहाँ पे काम कर रहे हैं, लेकिन कोई नेता यहाँ नहीं आएगा. No politician will even wear a PPE and step inside the hospital. Are you feeling that, Rishabh?
Yeah, I do feel it, but at the other side of it, I would say it is better that we do our job, they do their job. Our job is to treat patient, their job is to look after the administration. In a current situation, a pandemic where all the world, entire countries like Italy, US, big states are affected. Even their healthcare system is overwhelmed. I'm very sure that our Indian healthcare system is pretty underprepared.
I mean, we're 0.55 beds per 1,000 patients.
That's true. That's true. We have 0.55 beds per 1,000 patients. We have one doctor per 1,000 patients.
So did you feel too harshly judged by the media?
Yes, I do truly feel. I think it will try to create an identity crisis for the hospitals and the doctors itself. Because by these videos, are we trying to create a mistrust between the general population and the doctors and the hospitals, whether they should feel safe coming to the government hospitals or not?
I think that's a very important question, because the point being made here is that in countries like Italy and Spain, where there's much more percentage of GDP spent on health, their two hospitals were overrun with patients. We saw patients in the corridors of the hospitals. So I take it that when the dean was punished, you didn't agree with that.
Actually, ma'am, when a video is viral, and just because when video is viral, the administration who is working hard is being demoralized and is being transferred overnight. First of all, I would like to tell a few words about Dr. Ingve sir. He is a very hardworking man, and he used to work restlessly. He was always there for us. He was always there for the sake of the patient. He's always there for the sake of the faculty. But just because someone has come into the ward and has shot videos of dead bodies lying on the overbed, and instead of putting good inquiry, instead of just putting an inquiry, after inquiry also they just transfer the dean overnight. It is not a good. Anyways, we welcome Dr. Bharmal sir to our institute. He is also good administrator, but still somewhere we feel like the work of the Dr. Ingve sir is being understated.
So you feel that this approach of penalization is not the right approach. But let me ask you, Vishwadeep, let's understand why this is happening. Instead of judging it, let's understand why it's happening. So dead bodies wrapped in plastic in the same wards as patients are being treated. Videos have also surfaced now of more than one patient on one bed. Now, I have actually been inside Dharavi, and I've seen how small some of these hospitals are. I've been to another COVID hospital, the Sai hospital. It's a private hospital, but it has only 50 beds. So I've seen how crowded these hospitals can get. Can you talk a little bit about the resource, the demand-supply mismatch that's happening?
15 years से ऐसे Sion hospital is the smallest hospital, first hospital in highway. So and we have the Dharavi crowd. So ये condition पहले से ऐसा है.
तो आप कह रहे हैं पहले से भी ऐसा था, and people have suddenly woken up to this reality at the time of a pandemic. I think that's a very important point. In some ways, all of our inequities, all of our gaps in our system are being exposed at this moment.
Actually, ma'am, see the situation that unless and until a pandemic hit our nation, people were not caring about the healthcare system of our country. So it itself is a very,
What would you want people to know, and what makes you saddest or angriest right now?
People should actually, the first thing which I would like to highlight through your news channel is violence against doctor, about which everyone is talking right now.
Have you faced stigma?
Yes.
Tell me
Everyone.
what kind. All of you have faced stigma?
Either
Let's move out. They're all the 4 resident doctors here at Sion are saying that they face stigma. Tell me of what kind.
May it be physically or mentally.
Physical stigma also.
Physical in the sense.
Tell me what happened.
There was one medicine resident who was working in the COVID ward. Just because there was one patient who came late night, and he was critical, and he was very much critical, and he was not responding to treatment. And at around 12 at the midnight, the patient succumbed to death. But because the rage of the patient and denial of the gone of the relative was taken differently, and they were little bit they come on the doctor.
So that is another added problem. Last word to you. I think as Vishwadeep said, that pehle se bhi, because the hospitals have always been overstretched, there were more patients than there were beds. Today it causes a different kind of panic.
Yes, it causes a different kind of panic, but I would ask a general question to all the population or the media at large. Is this the right time to question the authorities, or is this the right time to question the hospital administration regarding it? We are in it together. Let's fight it together. Let's show the world that India too can fight it with meager resources.
At one point, we say doctors are the frontline worker, doctors are the corona warriors. And other time, when one warrior is fighting for you, do you backstab him by doing such things?
So this is another side to the story of Sion Hospital, and as you can see, it's just across the road from me, and I'll just walk and show you. This is the Sion Hospital where many patients from Dharavi, many poorer patients come for COVID treatment, and you heard the young doctors there. Those videos were horrifying, but they're saying that this is a hospital that always had meager resources, that always had more patients than there were beds, and this reality has always been there. It's just that we're shocked by it today because of the coronavirus epidemic.